Hello guys, how are you doing? It's Mr. Andutu here, Mr. Rational himself. Uh, as you can see, I'm having some materials on my hand, guys. I'm just from class, a lecture, a midwifery lecture, by the way. I've just been teaching on obstetrical emergencies, and today I've mainly taught about amniotic fluid embolism. And by the way, I've really dispensed knowledge carelessly, guys. And maybe just something on amniotic fluid embolism, guys. You know, this is actually a life-threatening obstetrical emergency that is actually very difficult to manage. It is basically a condition whereby the amniotic fluid, together with other fetal debris, vernix caseosa, gets access into the maternal circulation. And most of the time they actually trigger an anaphylactic reaction that of course will lead to a cardiovascular collapse, of course hypotension, and triggering things like DIC, which will of course lead to death. And this is a very complex obstetrical emergency that requires a lot of immediate and aggressive management. And maybe let me just take you through the pathophysiology very fast, guys. So amniotic fluid embolism mainly occurs when there is entry of amniotic fluid or maybe other fetal debris, hair, fetal hair, vernix caseosa gets into the maternal circulation. Then once it gets into the circulation, it triggers an anaphylactic reaction, an immune response. You know, the amniotic fluid acts as an antigen, triggers massive immune response into the mother. Then there is, of course, production of cytokines. Cytokines, amongst other mediators. These mediators now will actually cause pulmonary vasoconstriction, which will increase pulmonary resistance, increased pulmonary vascular resistance, that will lead to failure, right-sided failure of the heart. Consequently, there will be reduced preload on the left side, and of course we'll have cardiovascular collapse, which will manifest with reduced cardiac output. We'll have things like hypotension, you know, amongst other complications. Without forgetting, on the pathophysiology, we also have DIC. It will lead to disseminated intravascular coagulation, whereby there will be formation of the amniotic fluid, of course, contains tissue factor, which will activate the extrinsic pathway. The extrinsic pathway, which will lead to, of course, formation of very many clots, microthrombi into the microvasculature. And again, the body will react by consuming these clots and consuming all the clotting factors, which will actually now cause massive hemorrhage. So this patient is likely to present with a lot of shock, especially with that massive bleeding. We'll have hypotension, cardiovascular collapse, amongst other complications. So it is an emergency that requires a lot of particulate management, or else you can lose this mother. Risk factors, there are very many risk factors to amniotic fluid embolism, and these factors include anything that can increase the chance of amniotic fluid getting into the circulation. Some of the risk factors include, number one, conditions like placenta previa, placenta abruption, cesarean deliveries, you know, cesarean section, uterine rupture, of course, instrumental deliveries. You know, advanced maternal age also poses a very high risk to this amniotic fluid embolism, amongst others, grand multiparity, amongst others. Then on management, of course, the principles of management of emergencies will require, number one, immediate resuscitation and stabilization of the mother. ABC, very, very important. Ensure the airway is patent. Position this mother very well. Of course, giving oxygen, high flow oxygen, inserting two large bore cannulas, and aggressively giving IV fluids and blood products. You know, then after that, this client, of course, if you are in an ideal setting, the client should be nursed in an ICU where vasopressors should be administered. Vasopressors mainly act by increasing the blood pressure, increasing vascular resistance, increasing the blood pressure. Drugs like norepinephrine, very, very important. Inotropes, they're also very, very key drugs to be given in management of this particular condition. Examples of inotropes that can be given, of course, to boost the pulse rate, drugs like dopamine, very, very, very important. So guys, another key thing when you're managing this client, you should consider managing DIC aggressively. And you know, DIC is one of the most complex conditions to manage. Of course, in DIC, of course, give blood products, give fresh frozen plasma, you can transfuse platelets and manage it aggressively. And if you could identify the cause and manage it. In this case, you know, it's amniotic fluid embolism, so reversing it is even complex. So this is a condition that requires a lot of aggressive management. Thank you, guys.